Bedsores, also known as pressure ulcers or decubitus ulcers, are lesions caused by unrelieved, consistent pressure that result in damage to the underlying tissue. Essentially, the bedsore occurs if pressure to a particular point of the body has impaired circulation to the underlying tissue. Without appropriate blood flow, muscles do not receive oxygen and nutrients. Tissue and muscle deprived of blood begin to decay and die. Tissue that is closest to the bone generally undergoes this necrosis first, then travels towards the skin. As bedsores worsen, the skin opens up and the sores become larger and deeper. The worst bedsores can be so deep that bone is exposed. As you can imagine, the wound site contains millions of bacteria. The bedsore may become infected when the bacteria enter the tissue, then the body. Common complications due to the infection can include the following: cellulitis. This is a bacterial infection of the soft tissue around the wound. Cellulitis appears as a red area and may feel hot and tender to the touch. This infection is dangerous because it spreads quickly, including to the lymph nodes and bloodstream. Osteomyelitis. This is an infection of the bone. Osteomyelitis can develop quickly, often within a week. Symptoms include fever, fatigue, loss of range of motion, and swelling. Septic arthritis. This is an infection of the joint. Septic arthritis may result in intense joint pain, fatigue, weakness, swelling, and fever. Sepsis or bacteremia. This is an infection of the blood. Sepsis and severe sepsis, also called septic shock, may be very deadly. With sepsis, blood flow to the organs is damaged. The infection may also cause blood clots that lead to organ failure. This is why sepsis must be identified and treated quickly. The mortality rate for septic shock is almost 50%. If your loved one died of infection after developing bedsores at a nursing home and you're wondering if you have a claim, then please feel free to call and speak to one of our experienced Georgia nursing home neglect lawyers today. Our consultations are always free.